Greetings to everyone. Welcome back to another session of Physio Classroom. Today, I, Dr. Twinkle Kundnani, Assistant Professor at Sanjiti Institute College of Physiotherapy, will be taking a seminar on motor control. So today we'll be seeing what is motor control. So first thing, why is movement important? Starting from our morning till the time we sleep at night, every time we do n number of movements. Like whenever we get up, getting out of the bed, folding our bed sheets, taking a toothbrush in our hand, brushing our teeth, grooming ourselves, going to our work, coming back at work, doing multiple tasks like working on a computer, treating patients, seeing them, writing the assessment, we are dealing with n number of movement. So movement is essential part to carry out all the activities in our life, and to give life a movement, give life a meaning, movement is important. So today we'll be seeing how a movement is done, why a movement is important, and what is the essential factor that is necessary for your normal movement. Coming to our main question, why should we as a therapist know about motor control? Because we retrain patients who have motor control problems, producing functional movement disorders. We see a number of patients, be it a neuro patient, ortho patient, they have some or the other functional movement disorders. Example, if we are seeing a stroke patient who is just admitted in the hospital because of acute stroke, he'll give you n number of symptoms that are causing his movement restrictions. They'll give you complaints like, ma'am, I'm not able to get up from my bed on my own. I'm not able to move one side of the body. All these complaints lead to a particular disorder that will lead to a movement disorder or a functional movement impairment. And we as a therapist treat them, and we increase the patient's capacity to move, to improve their quality and quantity of postures and movement. As movement specialists, we deal with a number of postures. We deal with patients getting back to our movement. So it is our basic thing to know how a movement is done. If we know how we do a particular movement, if we know what is motor control, then we can plan the management in a proper way to get our patient back doing the functional activities and to improve his or her quality of life. So now coming to understanding the nature of movement. Like the first thing that I said, how a movement is done. What are the factors that define how the movement will be done? So there are three basic components or three basic factors. A movement emerges from three factors, that is individual, task, and environment. Now, why these three factors? If you see a pediatric patient, a child who has just learned how to walk, the walking pattern will be different. If you see a geriatric case whose proprioceptive loss is present, who have some or the other disorders like osteoarthritis leading to proprioceptive loss, will have a different type of walking pattern. Even though walking task is same, but two individuals are different. Similarly, if we are seeing, now these were the normal individuals like a pediatric and a geriatric population. If we see a patient who is having stroke, walk will have a different walking pattern, that is hemiplegic gait. He will not have that proper heel strike or push-off phase, leading to some disorders in gait. If we see on the other side, if we see a Parkinson patient, his gait will also be impaired, but the problem there will be with the initiation, and he'll give you a fascinating type of a gait. So if the individual himself will be an important part of movement. If we are seeing two different patients, they may have different complaints leading to different movement disorders, and you will have to treat the movement disorders depending upon what complaint your patient is giving or what condition your patient is having. In normal development also, pediatric patient will show you a different type of gait, and a geriatric will give you a different type of gait, because age and everything plays an important role. So first main factor for movement is individual. Second is task. What task you are performing is again important. If suppose I am walking in a normal environment, walking on a floor will give you a different type of like you will need different type of muscles on walking on a floor, and walking on the edge or on a small beam, you will need different muscles. So that is how task also differs. Walking needs different group of muscles. Walking on small beam will need different type of muscles. Similarly, walking or just standing are two different tasks. So standing needs static stability, while walking needs mobility factor more. So second part that is important for movement is task. Now coming to third important part, that is environment. Environment plays a very, very important role for movement. The example that I gave, like walking normally on the floor, you will need different muscles. Like if you have ever seen a patient, or if you ask anyone to walk on a small beam, patient will give you many complaints of balance loss. Now, why such complaints? Because here the environment is playing a crucial role. While walking on a normal part, I don't need to activate all my muscles. Yeah, I don't have that fear of fall. I can walk in a normal pattern. But when I'm walking on a small beam, or when my base of support is reduced, my environment will again play a role. That is, my base is small. I need to control my center of mass within that small base of support, and I need to walk. So that is how environment is playing a role. Again, second example, if I am walking on a floor or on a hard surface, my walking would be much better. If I am walking on a sand or on some smooth texture where my proprioceptive input is getting reduced or altered, again the environment plays a different role. Similarly, if you have seen stroke patients, when you ask them to stand from a height that is more tall, they will be able to stand. But the moment you ask your patient to stand from a lower height, they'll have some difficulty. So that is how environment plays role. And combining all these three factors, that is task, individual, and environment, movement will result. So movement will vary if your person is varying, that is either pediatric, geriatric, or any patient who is having some neurological complications or ortho problems, your movement will vary accordingly. Then your environment plays a very important role for your movement. So these are the three factors. Now coming in more details of individual. In individual, you have three factors: action part, then you have perception system, and your cognition system. Action system deals mainly with movement, so your motor component. So how motor component is playing a role in emerging movement? So action deals with your range of motion, your muscle strength, your recruitment of fibers, your proper posture, everything comes under action. So if my range is altered, or if my strength is altered, I won't be able to do a particular movement in a normal way. That is how action systems plays an important role. If suppose I want to pick up a glass of water, I need a proper range of my elbow flexion, extension. I need my wrist ranges. I need my wrist muscles to be strong so that I can grasp the particular object. Then I need elbow range, wrist range, so that I can bring that glass of water to my mouth. If anything is altered, my movement will be altered, and my movement would not be that smooth or normal that a normal individual can do. So that is how action system plays a very important role when we are dealing with individual or when we are seeing movement. So then second part is perception. Perception system deals with the sensory aspect. If I'm not able to perceive, if I have some sensory issues, I'm not able, mainly in proprioceptive issues, if I don't know where my joint is in the space, I will not be able to do a particular movement. Example, if we see any children who are having some sensory issues, their strength and their range, everything will be fine, but they are not able to perceive where they are in the space, or they are not able to perceive what action they need to do, which leads to movement impairment. Parents usually come and they complain that my child is not able to walk, he is not walking. But when you assess, range is complete, strength is normal. So where is the problem? The problem is the perceptual part or the sensory part. They are not able to perceive their own body. They are not able to perceive the environment. They are not able to perceive what action they need to do, because of which movement is getting hampered. Third important component in individual is cognition or your higher mental functions. If I'm not able to understand a particular command, if I'm not able to understand what action I want to do, I would not give a proper movement. If your patient is not understanding what you are telling them, if your patient is cognitively poor, or if the GCS of your patient is low, and if you're instructing your patient to do any movement, the problem is he's not able to understand what he needs to do, leading to your movement impairment. If you don't know how to do, your movement would not be in a proper way. So these three factors were very important when we were looking at the individual. You need proper motor systems, that is, you need proper range, muscle, strength, posture. That needs to be proper so that you get a good movement. Then in perceptual systems, your sensory part needs to be very good, especially the proprioceptive system, to get a good movement. Again, in perception, your visual and vestibular systems play a very important role. If I'm not able to see my environment, I won't be able to give a proper motor output. Then vestibular system. Why vestibular system? Is because vestibular systems is the main system that helps in the recruitment of your anti-gravity reactions, or helps in the recruitment of anti-gravity muscles. So if your vestibular system is affected, again your movement might get impaired. And third important part was cognition. If you don't know, if you don't understand, you won't be able to give a proper movement output. Now coming to a second component of movement is your task. So in task, again, you have three types. Some tasks will require mobility more. The example that I gave in the previous slide was walking, which requires your mobility more. So in that component, you need different ranges, you need different muscle acting in a synergistic way to give a proper movement or a proper output. So anything that will affect your mobility, your entire task or your function will get hampered. Second component in task is some task require stability. Stability is like sitting in a static posture, standing, sitting with your back supported. All these activities, they require a proper stability, proper recruitment of muscles to maintain that stable posture. And third type of task is manipulation. Manipulation deals with all the fine motor activity that we do. If we take a pen, to write a pen, we'll first grasp the pen. We need to hold it properly in a pincer grasp. We need to manipulate it, the pressure that we are using while writing, the strength of your intrinsics and your small muscles will all matter how you're manipulating a particular object and how the activity is done. So three components under task were, one was mobility, second was stability, and third one was manipulation. Now coming to our last domain and the very important domain, environment. Now in environment, you have two different components, like you have some regulatory factors and some non-regulatory factors. Regulatory factors are the one which define how the movement will occur. That is your shape of the object, your weight of the object, your size of the object. Example, if we take an example of grass needs almost the hand muscles. Yeah, the activity is done by your distal muscles. But the regulatory factors will define how you are grasping the object. If my grasp is a cylindrical grasp, if I want to grasp a bottle, I'll need different grasp. If I want to take a pen, if I want to have this pincer grasp, that will again give me a different factor or a different movement. So these are some examples of regulatory factors. Again, next example could be if I want to lift a half-filled bucket and if I want to lift a fully filled bucket, I'll need different weight. The weight of the object is different. So my force will change accordingly. So that could be an example of regulatory factors which define how your movement will occur. In non-regulatory factors of environment, non-regulatory factors do not define how the movement will occur, but it may alter the movement. Example, if we are doing activities in a environment where noise is more or where distractions are more, my movement may become altered. It is not defining how my movement will result, but it may alter the movement. If I am seeing a pediatric patient who is having this ADHD, attention deficit hyperactive disorder. And if I ask him to do activity where the environment is having many distractions, my patient will not be able to focus properly on the task and my movement will get altered accordingly. Similarly, if I am treating the same patient in a room where he is alone and where there are no distractions and he is focusing only on one task, my movement might be better. So that is how regulatory and non-regulatory factors of environment play a very important role in movement. So till now, we saw that for movement, you have three important components. You have individual, task, and environment. In individual, you have three features like action, perception, and cognition. Action deals with the motor part, perception deals with the sensory part, and cognition deals with your higher mental or to know how to do a particular thing. Coming to task, we saw three parts. One was mobility, second was stability, and the last one was manipulation. And in environmental feature or in the environmental part, you had two factors, regulatory and non-regulatory factors. So now this was the basic part, like how a movement emerges, how a movement is done and how it varies according to individual, according to the task we perform and according to the environment. Now coming to our next question, what is required to achieve a movement or a task? So all these factors that define movement, but what is required to achieve it? If all the three components are normal, how a movement is done? So you have three important parts. You have is motor program, motor plan, and motor control. Now we'll see each one of them. So motor program. So motor program, it is an abstract representation that when initiated results in a production of coordinated movement sequence. Example, complex neural circuitry in spinal cord known as central pattern generators that control locomotion and gait. So simplifying the part, so motor program, it is an abstract representation. As I said, if I suppose example of the central pattern generators, so they are situated in your spinal cord and they are responsible for your rhythmic oscillatory movements. So in gait or while locomoting, when our right leg is into the stance, swing, the left one will go into swing and come into the stance. This is rhythmical pattern. So if right is ahead, then later left will come ahead, again right, again left. So this is a rhythmic movement that is occurring at both the limbs. So you already have that abstract representation stored. And when we initiate the movement, we get a proper motor movement or we get a proper task that is being done is walking here. So program deals with an abstract representation, which when initiated leads in a production of coordinated movement sequence. Another example, if I want to pick up a glass of water, I already have that abstract representation in my mind that the glass is fully filled. I need to have proper coordination to, pick up the glass so that the water does not spill outside. And I'll first open my fingers, I'll grasp the glass and I'll try to take that glass close to my mouth so that I can drink the water. So this was an abstract representation that was already being there. And when I initiated it, I could get the proper movement. So motor program deals with an abstract representation. Now coming to motor plan. So plan, now the word plan itself deals with an idea. So it is an idea or plan for a purposeful movement that is made up of several component motor programs. So same example like grasping water. Glass of water. So we first saw that the glass was half filled or fully filled. We made an abstract thing that glass is half filled, so I need this much force. If I'm drinking water from a steel glass or from a glass which is of plastic, we need different forces. So you already make an abstract representation in your mind, or you already have a plan. The glass is made up of plastic, so my force should not be more, otherwise I may spill the water or the glass may squeeze. So I'll grasp the glass of water in that manner, and then when I'll initiate it, it will lead to a particular motor output, and it is a purposeful movement that is made up of component motor program. So you already have that abstract representation in your mind, looking at the size of object, looking at the weight of object, and when you initiate it, it leads to a proper planning. And when these two components, that is program and plan, they come together, you get a proper controlled movement or a component called as motor control. So motor control, it is a field directed at studying the nature of movement and how the movement is controlled. So what is motor control? So motor itself word deals with movement, and control is having a proper smooth movement. So motor control, it is a field which is directed at studying the nature of movement and how the movement is controlled. Motor control is defined as the ability to regulate or direct the mechanisms essential to normal movement. So three components that were responsible for normal movement were your program, plan, and control. Program and plan. Program was an abstract representation. Plan was multiple programs coming together, and when they were being done in a smooth and in a proper way, you would get a proper controlled movement. So now, how does this model or how does this stimulus or sensory input will go and how the motor output will result? So we'll be looking at this. So this is the model of information processing stages of motor control within the central nervous system. So what usually happens is you have the stimulus, like same example, if you want to grasp a glass of water, you have the sensory input. You look at the glass, whether it is made up of steel or plastic, whether it is fully filled or half filled. So that is the stimulus. So you identify the stimulus. So first one was stimulus, that I want to drink a water. Second was stimulus identification, that you were sensing, you were perceiving. So it reads your memory. If you have done anything previously, so that memory is stored in your brain. Example, if I have lifted a heavy fully filled bucket and half filled bucket, so I already know what force is required to lift a fully filled bucket and what force is required to lift a half filled bucket. So that is memory. Then you have response selection. So in response selection, you have interpreting, planning, and deciding. That is, you were first sensing that you want to drink water. You were looking at the glass. You were interpreting it that it is half filled, it is fully filled. You were planning, okay, I'll need this much force to lift a glass of water. You were deciding. And then that response, the selection that you have done, it is being programmed in your central nervous system by three parts, that is by translating, by structuring, and by initiating the response. And at the end, when combining all these things, you get a good motor movement output. So steps were, first was your stimulus, that is I want to drink. Then was your stimulus identification, looking at the glass of water, perceiving it, how it is half filled, fully filled, deciding what amount of force you need, what amount of ranges you need. Then, and when it was being initiated, it was leading to a proper movement output. So in the initial stage, that is in stimulation selection, so relevant stimuli about the current body state, movement, and environment are selected and identified. These include somatosensory inputs, visual inputs, and vestibular inputs. So like looking at the glass of water, you had this visual input. Touching it, grasping the glass, you had a somatosensory input. So that is how the initial response selection is being done. Then in the response selection stage, the plan for movement is developed. So as we already saw, the motor plan, it is defined as an idea or plan for purposeful movement and is made up of component motor programs like holding it, the force, the range, everything. They are the small components which when combined together give you a good motor output. And in the final stage, you have this response programming. So neural control centers translates and change the idea for movement into muscular actions defined by a motor program. So you're combining all the plans or ideas that you were having and you were getting a proper movement at the end. So motor program. So motor program, it is defined as an abstract representation that when initiated results in a production of coordinated movement sequence. The structuring of motor programs include attention to specific parameters such as synergistic component parts, force, direction, timing, duration, extent of movement. Parametric specification is based on the constraints of the individual, task, and environment. Same example, example of grasping a glass of water. So you were looking, you were judging, you knew this much force is required, and accordingly you were planning and doing the movement. So again, if the glass is of wine or it is a normal glass of water, it will define how you need to pick, which grasp you need. Programming can also be initiated by a response. Response can also be affected by a response compatibility. This is the compatibility of dual movement task that either occurs simultaneously, that is bouncing a ball while walking, or when choices are required, that is one paired movement response occur before another. So programming, it is like dual tasking could be required, or it could be if you need only one specific movement. Example, if you're playing a basketball, you need dual tasking, like you need bouncing a ball and you need walking simultaneously. Or when choices are required in which you need to focus on one part. If you are batting while playing a cricket, you need to focus on one part, like when the ball is coming, which movement you need to do, how much force needs to be applied. So that is how a programming is done. And during response execution, that is, or on motor output, muscles are selected against an appropriate background of postural control. So now again, you have two important things that define movement. You have something called as feed forward control and the other one as feed back control. So feed forward control is something that is already there in advance of a movement to ready a part of a system for incoming sensory feedback or for future movement command. It allows for anticipatory adjustments in postural activity. Example, if I am walking and while walking, if I'm already seeing there is a puddle in front of me or there is some obstacle in front of me, I will change my route, or I'll just, recruit, I'll just lift up my leg. Okay, I'm not I lift up my leg so that I can cross over that obstacle and I can go. It is the feed forward control, which is already in anticipation. Before doing a particular task, you already know what strategies you need to do and what muscles you need to recruit is a feed forward control. Feedback is something that you get after doing a particular movement. So feedback is a response produced sensory information received during or after the movement and is used to monitor motor output for corrective actions. Example, if I am walking and if I get some perturbation, I'll try to balance myself after the perturbation is being received, or if while walking, if I have something that is some perturbation or some sort that my balance is being getting hampered, I'll try to change my muscles or recruitment accordingly, and I'll try to get a good movement output. So these were the two things. One was your feed forward, that is already in anticipation. Yeah, you already know what adjustment you need to do to get a particular movement. And feedback is after a response is, the response is done after the stimulus is being received, during or after the movement. So to end with, so motor control, it is a field directed at studying the nature of movement and how the movement is controlled. So we saw motor control basically deals with movement, how a movement is done, what all things are required to do a particular movement. And motor control is defined as the ability to regulate or direct the mechanisms essential for movement. So thank you. This was about the introduction to motor control. Yeah, how a movement is done, what all things are required to do a particular movement. In the next session, we'll be seeing about the theories of motor control and how motor control has been developed or how it has evolved over many last years. So now I would first like to thank Dr. Parag Sancheti sir, our chairman, Mrs. Manisha Sanghvi ma'am, our executive director, our beloved principal sir, Dr. Apurva Shimpi sir, to the entire technical team of Physio TV classroom, and to all the viewers for joining for this session. Hope to see you all in the next session. Thank you.